In today's lecture, we are going to talk about cholinergic antagonists. Cholinergic antagonists are the drugs which block or opposes the cholinergic activity at central or peripheral nervous system. To understand anticholinergic drugs or cholinergic antagonists, we have to divide it into two main types: antimuscarinic drugs and nicotinic blockers. The nicotinic blocker drugs are then further divided into ganglionic blockers and neuromuscular blockers. Let's discuss all of these drugs one by one in detail, starting with antimuscarinic drugs. Antimuscarinic drugs are defined as those drugs which block the muscarinic activity by specifically blocking the muscarinic stimulation at M1, M2, and M3 receptors. The most famous and most commonly used drug in this category is atropine. Atropine is a tertiary amine, which means it's not a charged body, so it can cross the blood-brain barrier easily. It also has a diffuse antimuscarinic effect on all of the muscarinic receptors M1, M2, and M3. By blocking muscarinic receptor M1, it can decrease the motility and decrease secretion of the gastric glands. By blocking the M2 receptor activity on SA and AV node, it can cause increase in the heart rate. In similar manner, by blocking the M3 receptor stimulation at different organs, it can cause inhibition of salivation, inhibition of sweating, and also cause bronchodilation. It can also cause mydriasis when used ophthalmically. The therapeutic use of atropine is pretty much easy to understand. As we know, it can cause mydriasis, pupil dilation when used ophthalmically. It can also cause tachycardia, so can be used to treat hypotension, and can also cause bronchodilation in the treatment of asthma. The next antimuscarinic drug is scopolamine. Scopolamine is a drug which is used prophylactically for motion sickness. The duration of action of the drug remains for 3 days. Furthermore, it is a tertiary amine, so we can assume that it can cross the blood-brain barrier, and for this reason, it is known to cause CNS euphoria, which sometimes can be the reason for its abusive use. Scopolamine is also known to block short-term memory, inhibiting adaptive learning. Anticholinergic drugs can also be used in the treatment of asthma because they cause bronchodilation, providing relief to the patient immediately. Specific anticholinergic drugs used for this purpose are tiotropium and ipratropium. Tiotropium and ipratropium are basically same kind of drugs. The only difference is the duration of action. Tiotropium is a long-acting, while ipratropium is a short-acting, which is used 4 times daily. The fourth anticholinergic drug is oxybutynin. Oxybutynin is a drug which blocks M3 stimulation at bladder muscles, causing relaxation of the detrusor muscles and inhibition of urination. For this reason, oxybutynin is used in overreactive bladder. Some anticholinergic drugs like benztropine and trihexyphenidyl can also be used in the management of Parkinson's disease. For those people who don't know about Parkinson's disease is a neurodegenerative disease of dopaminergic neurons, resulting in decreased level of dopamine and increased level of acetylcholine levels, which normally are equal.